Hey everybody, and welcome back to Sip and Talk. Wait, so get this right. The other day, I'm trying to make my grandma's apple pie recipe.
Uh-huh.
You know? Thought it'd be all sentimental, like bring back good memories, but guess what?
What?
Turns out measuring cups are like totally different now than they were back then.
Oh no.
My pot, I swear it looked like a sad little pancake, kind of like squished on one side.
Oh no.
Because it made me think like, wow, the things we think we know, sometimes they're not what they seem. You know?
That's a really good point, actually. Yeah, like we go through life thinking we got it figured out.
Right.
And then you realize there's this whole other layer underneath.
Exactly. And that is what we are doing today, folks, because you sent me this huge stack of stuff about healthcare.
Yeah.
Healthcare in Taiwan, in the U.S. We all have opinions about healthcare.
Of course. We've all got stories.
We've all been there. But today, we are going deep, deeper than just like the surface level stuff.
Absolutely.
It's a mission for today. We're going to figure out how these two systems actually work, the good, the bad. Maybe even the stuff that's making everyone nervous about money.
Yeah.
You know?
The financial side of things.
Yeah, exactly.
It's a chance to get past all the like political stuff and actually look at the structure, how it's funded, how it affects people's lives in two really different places. And speaking of different worlds, Taiwan's system gets a lot of praise, so maybe that's a good place to start.
Yeah, makes sense to me. All right, so Taiwan's healthcare, they've got this thing called National Health Insurance, or NHI.
Right.
And globally, people are raving about it. I mean, look, seriously, top rankings.
Oh, yeah.
One of the reports you sent me, they were #1 on the Numbeo Healthcare Index back in 2021.
Wow.
And even this year, 2024, still up there, the top.
Yeah.
They got first place in CEO World and 15th in the World Medical Innovation Index.
That's impressive.
And that one, that looks at like how much choice you have as a patient, the quality of care, all the tech stuff they use, and if it's like financially stable.
Yeah.
15th in the whole world, that's got to mean something, right?
It really is, and it shows a totally different way of thinking about healthcare than what we're used to in the U.S.
For sure.
Like their dedication to covering everyone, that's a big deal.
Yeah. One of the articles called it Okne-A.
Right.
Literally means every single citizen, every legal resident there covered. Like, think about that.
Yeah.
No more freaking out if you lose your job, and boom, no more health insurance.
Exactly.
No more wondering if you can even afford to go to the doctor. It's a whole different world.
Yeah.
It's like healthcare isn't a privilege there. It's just like a basic thing everyone deserves. And that's going to make a huge difference for their overall health as a country.
Absolutely. In the U.S., we've still got that big issue of people not having insurance at all. And beyond just who's covered, another big reason Taiwan gets ranked so high is how affordable their healthcare is.
The prices are crazy. You're not going to believe this. A regular trip to the clinic, it's like 50 to 150 new Taiwan dollars.
Wow.
That's like, what, $2 to $5 in U.S. money?
That's unbelievable.
I know. And most of it's paid for through these premiums people pay based on how much they make. But the government helps out folks who don't earn as much. And people working for the government, like civil servants, you can actually go see a doctor without going broke.
That makes such a difference because it means people are way more likely to go see the doctor when something's wrong.
Right.
Catch those illnesses early. Keep everyone healthier overall.
Yeah. It's not just cheap either. Their healthcare is supposed to be really good.
Right. High quality.
They've got everything from like stop you from getting sick in the first place to seeing specialists to mental health help. And guess what? People are actually happy with the care they get.
That's fantastic.
And they're super tech savvy too. Everyone's got these little medical ID cards with their whole health history and insurance info right there on it. So much better than my doctor's office. Still using fax machines.
I know. It's amazing how much they've embraced technology. It streamlines everything, makes it so much easier for patients and doctors to communicate and get things done.
Makes sense.
And it really helps them track medical information and make sure everyone's getting the best possible care. And a big thing is the data shows this whole system covering everyone, making it affordable. It's really helped even things out for people who don't have as much money,
Yeah.
And that's actually led to people living longer. Plus, you hear about short wait times to see a doctor, and they're super efficient, which is rare for healthcare systems, right?
Totally. In a lot of developed countries, waiting months to see a specialist is just normal life. It seems like Taiwan's figured out how to do it right.
They have.
But now, comparing this to the U.S. healthcare system, ooh, boy, get ready for a wild ride.
That's a good way to put it. Where do we even start?
I know, right?
I think for most Americans, the first thing that pops into their head is the cost. It's just so expensive. and not everyone's covered. And the whole system, it's like trying to figure out a puzzle in the dark.
Oh, yeah.
One of the things I read said back in 2016, there were about 27 million people in the U.S. without any health insurance.
It's mind-blowing.
That's like a whole country worth of people just no insurance.
And the consequences are huge. If you don't have insurance,
Yeah.
you're way less likely to go to the doctor even when you really need to.
Exactly.
And that can lead to bigger problems later on. One report said 40% of Americans have put off going to the doctor or just skipped it altogether
Yeah.
because they were worried about how much it would cost.
Yeah.
That's just sad, you know?
It really is. And even if you do have insurance, it often feels like it's designed to not cover the things you need.
Oh, totally.
Like 23% of people said their insurance doesn't cover certain treatments.
Right.
You pay all this money every month and then they're like, nope, sorry, not covered. What's the point?
Seriously.
All those limits on what's covered, plus the crazy out-of-pocket costs, it puts a huge burden on people financially. And then there's the whole administrative nightmare, the sheer amount of money that gets wasted in our system just on paperwork and bureaucracy.
Don't get me started on the paperwork. It never ends.
It's unbelievable.
One source said something like 8% of all the money we spend on healthcare in the U.S. goes to administrative costs.
It's ridiculous.
In other developed countries, it's more like 2 to 3%.
Right.
We're throwing away billions of dollars just shuffling papers around. And don't even get me started on wait times here.
Oh, yeah, those are awful.
31% of people complain about how long they have to wait for an appointment. Sometimes you wait longer to see a doctor than you wait for your takeout.
That's so true. And, you know, everyone talks about preventative care, like catching things early, keeping people healthy. That's the key to lower costs, right?
Yeah.
But only 19% of people in one survey thought the U.S. system was doing a good job with that.
So we're spending the most money.
Way more than any other developed country.
And one of the articles from the Harvard Business Review, they said we're actually in last place out of 10 high-income countries when it comes to how well our healthcare actually works.
We're spending the most and getting the worst results.
Doesn't make us look too good, does it?
Not really. And a big part of why things are so messed up here is how our insurance works, especially this whole thing with high deductibles.
Ugh, the deductible. Yeah. It's like you pay your monthly bill for insurance, but then if you actually need to use it, you got to pay thousands of dollars yourself before the insurance company even lifts a finger.
I know.
Like you had that example in your notes, a $5,000 deductible and a $4,800 medical bill.
Oh, yeah.
You're paying the whole thing. It's like, what's the point of even having insurance if it doesn't cover those costs?
Exactly.
Yeah.
It just shifts so much of the cost up front onto the patient. And then there's the whole in-network versus out-of-network mess.
Oh, man, that's a whole other can of worms.
You
You do your research, you pick a plan, you think you're good to go.
Yeah.
Then you end up in the ER, you get treated by a doctor who happens to be out-of-network, and boom.
$100,000 bill.
A $100,000 bill, and your insurance is only covering like $5,000.
That's a nightmare.
How is anyone supposed to plan for that? It's like playing the lottery with your health, and the odds are definitely not in your favor.
And it can completely ruin people financially, sometimes even leading to bankruptcy.
It's scary.
And it's not just about unexpected emergencies either.
Right.
Even planned treatments can get delayed or denied just because you need prior authorization from the insurance company.
Oh, yeah, the permission slip from the insurance folks before your doctor can even do what they think is best for you. Remember that story about the cancer patient?
Oh, yeah.
Treatment got delayed because of some paperwork issue with the insurance. Can you imagine the stress of that?
Yeah.
Your life is literally on the line,
Yeah.
and you're waiting for some insurance person to sign a piece of paper. It's just wrong.
It really shows how all this red tape can actually get in the way of people getting the care they need when they need it.
Totally.
And we can't forget about all the problems people with pre-existing conditions had before the Affordable Care Act. And there's still loopholes and limitations even now. Just to give some context, the ACA, or Affordable Care Act, that was a big law they passed to try and get more people covered by health insurance.
Right.
Before that, you could actually get denied coverage just because of something you had wrong with you before you even tried to get insurance.
It's crazy.
It was nuts. And even now, it feels like insurance companies are always looking for ways to get out of paying claims. I even read some stuff about them using artificial intelligence now to automatically deny claims.
Yeah, that's messed up. Denying claims with AI that takes 1.5 seconds to make a decision.
I know, it's very concerning. Like Cigna, they've got this AI system that reportedly denied hundreds of thousands of claims in seconds. And then there are the accusations against United Health that they had a whole plan to systematically deny claims.
Wow.
It makes you think, are they actually trying to help people get health care, or are they just trying to save money and make their CEOs richer?
Speaking of which, Have you seen the salaries these insurance CEOs are making? It's insane. Billions in their pockets, while millions of people are getting their legitimate claims denied. It's just not right. And then you look at those numbers from the Kaiser Family Foundation, over 850 million denied claims out of 5 billion filed every year in the U.S. And even for those ACA marketplace plans, the average denial rate is 20%.
Some plans deny up to a third of all claims.
It's unbelievable.
It really makes you wonder if the focus is on profits over people, doesn't it?
Yeah, it does. So we've talked a lot about the U.S. system. Now let's switch gears back to Taiwan.
Okay.
Because even though their healthcare system gets all this praise, there's this whole thing about it potentially going bankrupt. That kind of surprised me.
Yeah.
If it's so great, why are they worried about money?
Well, there are a few things going on. One big concern is that over time, they've been spending more on healthcare than they're taking in. Like from 1996 to 2008, their spending went up by an average of 5.33% each year, but their revenue only went up by 4.43%. Even a tiny difference like that, it adds up over time, you know?
Makes sense. If you're spending more than you're earning, eventually you're going to run out of money.
Exactly. And then there's a whole aging population issue. It's happening in a lot of countries, but it could really hit Taiwan's healthcare system hard.
Oh, yeah, we're seeing that everywhere.
They're predicting that by 2030, over 20% of Taiwan's population will be 65 or older. And older people tend to need more medical care, which means more money spent per person.
Mm-hmm.
Some experts think that by 2030, healthcare costs per person could be double what they were in 2020.
Yeah.
That's a huge jump.
Yeah, that's a lot of money.
It puts a lot of pressure on their system.
And I remember reading something about overseas residents maybe taking advantage of this system too. Something about a stop and restart policy. What was that all about?
So basically, Taiwanese citizens who lived in other countries for a long time, they could pause their NHI coverage and then restart it pretty easily when they came back to Taiwan. And a lot of times they would do this right before they needed some kind of medical treatment.
Interesting.
So they could avoid paying into the system for years, but then still use it for expensive procedures when they needed to.
Sneaky.
Like a knee replacement surgery costs about $50,000 in the US.
Yeah.
But in Taiwan, it's only about $5,000.
Wow, big difference.
So you can see why people might try to game the system a little bit.
Yeah, so people were flying in, getting great health care for cheap, and then flying out without really contributing.
Exactly. It put a real strain on their finances.
Not to mention, it's not exactly fair to the people who are paying into the system all along.
Right. And all the administrative work to manage this stop and restart thing, it cost them money, too.
I bet.
Plus, they could never really predict when people were going to come back and need healthcare, so it made budgeting really tough.
Uh-huh.
It's worth pointing out, though, that they've gotten rid of this specific stop and restart policy now, which is a step in the right direction, but they still need to figure out a way to make sure overseas residents are contributing fairly.
Yeah, big cuts.
And speaking of fairness, the case of this guy Huang An really brought this issue to light.
Oh, yeah. I just want to give another shout out to Micky from Mickytolife. His channel is a treasure trove of inspiration, and he's a huge Sip&Talk fan.
Absolutely. Make sure to check him out and maybe even share your awesome podcast intro with him once you've created it.
Huang An. That was a big story in Taiwan, right?
Huge.
He had been living in mainland China for years, even said some not so nice things about Taiwan publicly.
Right.
But he still had his Taiwanese citizenship and was enrolled in NHI.
Yeah.
Then in 2016, he comes back to Taiwan specifically to get treatment for a serious heart condition. He just pays a small co-payment, and the NHI covers almost all of it.
A lot of people were really angry about that.
I bet they were.
They felt like he hadn't been supporting the system but was still benefiting from it when he needed expensive care.
That's not right.
It really got people talking about fairness and responsibility and whether the NHI could survive in the long run if people could exploit it like that.
Makes you wonder.
And it's not just these high-profile cases either. They're also worried about how often some elderly people in Taiwan go to the doctor.
Right. I read about that too. Apparently, some older folks go to the clinic all the time, sometimes every day or every week.
It's true.
A lot of times it's to get prescriptions for chronic conditions, but sometimes they even go to multiple clinics for the same problem.
Yeah, and all those visits, they add up and cost the system a lot of money.
It's got to be putting a strain on things.
It is, and it has to do with how the NHI is set up. One thing is they have a pretty loose reimbursement policy.
What does that mean?
Basically, there aren't many limits on how many times you can go see a doctor for an outpatient visit.
Oh, interesting.
Unlike in the US or Canada, where you often have to pay more each time you go, or there's a limit on how many visits you get for a specific problem.
Okay.
In Taiwan, you can go to the doctor a lot, and it doesn't cost you much out of pocket.
So it's like there's not much stopping people from going, even if it's for something small.
Right. And the way they do prescriptions also plays a role.
Oh, yeah. How's that?
Usually prescriptions for long-term medications, they're only good for 30 days.
Right.
Compared to like 90 days or even longer in some other countries like Japan and parts of Europe.
That's a big difference.
So that means people need refills more often, which can lead to more doctor's visits just to get those refills.
That makes sense.
And because the copays are so low for both the doctor's visits and the medications, there's really not much of a financial reason not to go to the doctor, even for something minor.
It's like going to the doctor is just easy and cheap.
It is, and while that's great for access, it can also lead to people relying on the healthcare system too much.
So it's almost like it's too easy to go.
Kind of. And for some people, especially older folks, going to the doctor might even be part of their social routine.
Oh, yeah, I read something about that.
One article talked about how some people go to the doctor for social interaction, and because there's not much emphasis on taking care of their health proactively.
So it's like a cultural thing, too.
It is. And on top of that, Taiwan has a ton of clinics, which makes the healthcare market really competitive.
Oh, wow.
And that competition could actually be encouraging doctors to see patients more often.
Interesting. So they're all competing for patients.
Exactly. And there's even worry that some of the medications people get from all these prescriptions might end up being sold illegally.
Seriously?
Yeah, which is a whole other problem contributing to waste and abuse of the system.
So we've talked about all these challenges Taiwan's healthcare system is facing.
Yeah.
What are some of the ideas they're considering to fix things? And looking at the bigger picture, are there any lessons we can learn from Taiwan's experience in the U.S., both from the things they're doing well and the problems they're running into?
So for Taiwan, most of the proposed solutions are focused on tackling those issues we've been talking about.
Okay.
Stopping overseas residents from taking advantage, reducing how often people go to the doctor, and making sure the whole system is financially stable in the long run.
Right. So how are they going to deal with the overseas residents thing?
Well, they've got a few ideas. One is to make people pay into the NHI for a certain amount of time before they can re-enroll.
Makes sense.
Like they have to have paid continuously for at least a year or lived in Taiwan for a certain amount of time. Another idea is to make them wait a while before they can get full benefits again after they re-enroll.
Okay.
Maybe like 6 months of paying premiums. This is to stop people from just coming back to Taiwan for a quick surgery and then leaving again without contributing much.
That's smart.
They're also thinking about making the rules stricter for people who live abroad long term.
Like how?
Maybe charging them higher premiums, like 1.5 times the normal rate after they've been gone for a certain number of years.
Okay.
Or making them go through a whole reapplication process if they've been gone for a really long time, like 5 years or more. And maybe even make them live in Taiwan for a while before they can re-enroll.
Are they really trying to close those loopholes?
They are. And they're looking into ways to share medical information between countries so they can keep track of what kind of healthcare people are using when they're abroad.
Oh, that's interesting.
And then there's been talk about raising the co-payments for serious illnesses like heart disease or cancer, especially for people who haven't been paying into the system regularly.
Yeah, that seems fair. What about all those frequent visits and overprescribing, especially among older folks?
So for that, the goal is to get people to use the healthcare system more efficiently.
Okay.
Cut down on unnecessary visits and medications. One big idea is to make those prescriptions for chronic conditions last longer.
Oh, that makes sense.
Instead of just 30 days, maybe 60 or even 90 days. So people don't have to get refills as often.
Right.
And they want to make it easier for people to get their prescriptions filled without having to go see the doctor every time.
Oh, that would be nice.
They call it prescription separation. It means after the first visit, you could just go to a pharmacy for refills.
Convenient.
And they're considering something called tiered co-payments for outpatient visits.
What's that?
Basically, the more times you go to the doctor in a month, the more you have to pay each time.
Oh, so it discourages people from going too often.
Exactly. They're also thinking about offering an option for people with chronic conditions to have fewer doctor's visits, but get longer prescriptions, maybe 90 days at a time.
Okay.
And to make all of this work, they need to improve their medical information systems so they can keep better track of everyone's medications and make sure people aren't getting the same prescriptions from different doctors.
Yeah, that sounds important.
And they need to crack down on people selling NHI drugs illegally.
Got it.
And finally, they're realizing they need to invest more in community health programs and support family doctors.
Why is that?
Because if people have more support for staying healthy and managing their own conditions, they might not need to go to the doctor as often.
That makes sense.
It's all about shifting the focus to preventative care and keeping people healthy in the first place.
So lots of changes on the table. Yeah. What about the big picture stuff, like the overall financial health of the NHI?
So to keep the NHI afloat long term, they're talking about some big changes.
Okay, like what?
They might change how premiums are calculated so people who make more money pay more.
That seems fair.
They're looking at getting more funding from the government, and they might start limiting certain medical procedures or make people pay more if they use the system a lot.
Got it.
And of course, they're always trying to make things more efficient so they can get the most out of their resources. And they're starting to think seriously about how they're going to handle the needs of an aging population.
That's a big one.
Like coming up with plans for healthy aging and expanding home care options so people don't have to stay in hospitals as long. So basically, they're trying to tighten things up, make sure everyone's contributing fairly, and really plan for the future.
So it's a lot of moving parts.
It is.
Now, switching gears, completely thinking about the U.S., what can we learn from Taiwan?
Well, obviously, the U.S. and Taiwan are very different places with very different political systems.
Of course.
But I think there are still some big takeaways. Like Taiwan shows us that it's possible to have a system where everyone's covered and the costs are controlled. They call it Youytube. It's like a single-payer system.
Right, I've heard of that.
Now, obviously, getting something like that done in the U.S. is a whole other story politically, but it's something to think about. Another thing Taiwan does that we could learn from is negotiating drug prices with pharmaceutical companies.
Oh, yeah, we've talked about that before.
They get much lower prices than we do in the U.S., and that saves them a ton of money. We could also stand to simplify our administrative processes.
Ugh, the paperwork.
All that bureaucracy is costing us money and making things less efficient. And we could definitely learn from Taiwan's focus on preventative care.
Yeah, we need more of that.
If we invested more in keeping people healthy in the first place, it could save us a lot of money down the line. And finally, both Taiwan and the U.S. are struggling with this idea of health equity.
Right, making sure everyone has access to good care no matter how much money they make.
Exactly. That's something we all need to keep working on.
So we've covered a lot of ground today. The good, the bad, and the potentially bankrupt.
We have.
Anything else we should touch on before we wrap things up? Any interesting tidbits from all that stuff you sent over?
Oh, yeah. Actually, there are a few more things.
Okay, hit me.
So one thing is Taiwan's National Health Insurance Database. It's a goldmine for researchers.
Really?
They've got data on millions of patients, and it's been used for over 6,500 international research studies.
Wow, so people are studying Taiwan's system all over the world.
They are. It's helping them understand healthcare trends, how well different treatments work, and all sorts of public health issues. And Taiwan's also working on this new cloud-based system for their NHI called NHI 2.0.
Ooh, fancy.
It's all about using technology to make things smarter and more efficient. But they still have challenges too, of course, like finding that balance between keeping costs down and making sure people are getting high-quality care.
Right.
They've got shortages of doctors in certain specialties and in rural areas. They've got a low birth rate, which means there might not be enough healthcare workers in the future.
Oh, yeah, that's a problem in a lot of places.
And they're working on being more transparent about the costs of medical treatments that aren't covered by the NHI.
Okay, so it's not all sunshine and rainbows.
Not exactly. And one more thing that's interesting is that compared to other developed countries, Taiwan doesn't actually spend that much of its money on healthcare.
Oh. Yeah.
In 2022, it was about 7% of their GDP, which is less than Japan and South Korea.
That's interesting. So they're getting a lot of bang for their buck.
They are. But it does make you wonder if they'll be able to keep it up, especially as their population gets older.
That's true.
And right now, most of the money for the NHI comes from working people, but it's the elderly who use the most healthcare. So there's a bit of an imbalance there that they need to figure out.
So basically, we've seen that Taiwan's healthcare system, it's got a lot going for it.
It does.
Everyone's covered. It's affordable.
Yeah.
Quality of care is good.
Yeah.
But they've got these financial pressures they're dealing with.
Yeah.
Rising costs, an aging population, some kinks they need to work out.
Right.
And they're trying to make changes to make sure it survives.
Exactly.
Meanwhile, the U.S. system, we're spending more than anyone, but we've got huge problems with costs and people not being covered and just a lot of inefficiency.
Well, both systems have their strengths and weaknesses, and they're both trying to figure out how to provide good care for their people without breaking the bank.
It's complicated.
Right.
No easy answers. Well, this has been a real deep dive into healthcare around the world.
It has.
Definitely gives you a lot to think about.
It does. Healthcare is a big, messy, complicated issue.
So for those of you listening out there, maybe think about this.
Okay.
What could the U.S. and Taiwan learn from each other? I mean, Taiwan's all about covering everyone and keeping costs down. And the U.S., we're good at the whole medical technology and research thing.
Right.
Could we combine the best of both worlds somehow?
Maybe.
Or even more basic, what should healthcare be all about in any country?
That's the big question, isn't it?
It is food for thought, for sure.
It is.
And before we go, a quick shout out to our buddy Micky. If you're into travel vlogs, whiskey reviews, and awesome original music, you got to check out his YouTube channel, Mickytolife.
He's great.
Seriously, you won't be disappointed. That's all the time we've got for today, folks. Thanks for joining us on The Deep Dive.